The impact of Medicaid cuts on families with disabled children. Imagine a world where the most vulnerable among us, children with disabilities, are left without essential support. It's a chilling thought, isn't it? But this is the reality that families like the Staggs are facing as Medicaid, a lifeline for millions, comes under threat due to recent policy changes. And here's where it gets even more alarming. These cuts could mean life or death for children who depend on Medicaid-funded care to survive. Take Emma Staggs, an 11-year-old girl from North Carolina, for example. Born at just 1 pound, 9 ounces, Emma has faced extraordinary health challenges since day one. She lives with bilateral vocal cord paralysis, chronic lung disease, developmental delays, and other daily struggles that make basic functions like eating and breathing impossible without assistance. 5 times a day, her mother Stacy or a nurse feeds Emma through a feeding tube using a doctor-prescribed formula. This formula costs $25 per bottle, totaling $125 daily, a cost covered entirely by Medicaid. Without this coverage, Emma's survival would be in grave jeopardy. Medicaid doesn't just pay for Emma's formula. It also covers critical medical equipment such as a pulse oximeter, oxygen concentrator, and portable oxygen tanks for travel. The program funds in-home nurses, who help Emma eat and breathe, occupational therapy sessions at a specialized farm, and even horseback riding physical therapy that helped her gain enough strength to climb stairs this year. For the Staggs family, Medicaid is not just a safety net, it's a necessity. If we get to a place where we're no longer eligible, Stacy says, I can start a timer on how much longer Emma will be alive. But why does this matter now? Because President Donald Trump's recently passed reconciliation package slashes federal funding for Medicaid, leaving states scrambling to decide which programs to cut. Programs like the Katie Beckett waiver, or Community Alternatives Program for children, that provide home-based care for kids like Emma are particularly vulnerable. These waivers allow families to avoid institutionalizing their children by providing financial support for at-home care. If these programs are eliminated, the consequences could devastate families already stretched thin. Stacy fears the worst: selling their house, moving in with relatives, or even declaring medical bankruptcy to keep Emma alive. We would go into medical bankruptcy to keep Emma alive, she says bluntly. Meanwhile, officials from North Carolina's Department of Health and Human Services remain tight-lipped about whether the waiver will survive the impending budget cuts. James Werner, a spokesperson for the department, told USA Today that they are reviewing the final legislation to determine its full impact. This issue extends far beyond the Staggs family. Millions of children and adults with disabilities rely on Medicaid for medications, equipment, and staff necessary for their survival and inclusion in their communities. Many caregivers, often mothers, must juggle jobs and caregiving responsibilities, sometimes sacrificing careers entirely to ensure their loved ones receive proper care. With reduced Medicaid funding, this burden will only grow heavier. Consider Lindsay Latham, a mother from Virginia, whose 11-year-old son Calvin requires constant assistance due to a brain malformation. While his condition has improved over time, he still needs help with eating, drinking, bathing, and dressing. Medicaid fills the gaps left by private insurance, covering essentials like adaptive strollers, speech devices, and in-home attendant care. But with stricter eligibility checks looming, Lindsay worries about losing these crucial supports. To make it harder for people who are working to fill out paperwork to maintain their medical coverage, she says. It's cruel. And then there's Mary Caruso, a Connecticut mother raising 2 adult children with Friedreich's ataxia, a rare genetic disorder affecting the nervous system. Thanks to Medicaid's Community First Choice program, both her children lead fulfilling lives, working jobs and participating in community events with the help of attendants. If Connecticut reduces funding for this program, Mary fears she'll have to quit her job to become a full-time caregiver. "I don't know what we would do without them," she admits. The ripple effects of these cuts are profound. Families like the Rothschilds, whose daughter Chloe achieved independence after years of preparation, may see those hard-won gains reversed. Chloe, diagnosed with autism at age 3, spent over a decade honing skills to live independently. Now 32, she thrives with the help of Medicaid-funded direct support providers. Losing this aid could force her to move back in with her parents, undoing years of progress. So what's at stake here? For many, it's nothing less than life itself. Advocates argue that opponents of Medicaid fail to grasp its true value. As Kim Mushito of The Arc puts it, critics just see a price tag rather than the humanity behind the numbers. Sarah Rosenbaum, a professor of health law and policy, echoes this sentiment, warning that destroying Medicaid would leave no path to recovery for countless individuals and families. Supporters of the GOP-backed cuts claim the system needs reform to eliminate waste and inefficiency. Speaker Mike Johnson argues that able-bodied individuals should work to qualify for benefits, while undocumented immigrants should be excluded altogether. Yet, these arguments overlook the complexities faced by families caring for loved ones with disabilities. As debates rage on, one question remains: what kind of society do we want to build? One that prioritizes efficiency above all else, or one that values compassion and inclusion? We invite you to share your thoughts in the comments below. Do you agree with the proposed Medicaid cuts, or do you believe they threaten the very fabric of our communities? York County Medicaid cuts: impact on families with special needs. A mother from York County, who relies on Medicaid to support her disabled son, is deeply concerned about potential funding cuts. A recent forum highlighted these fears. The absence of elected officials at a York County forum discussing the implications of the Big Beautiful Bill raised eyebrows. The proposed reductions to Medicaid could have severe consequences for families with children who have disabilities and depend on this essential program. Leslie Seiford's oldest son, Landon, was born in September 2010 with pontocerebellar hypoplasia, a rare genetic disorder that leads to the underdevelopment of critical areas of the brain, specifically the pons and cerebellum. This condition has resulted in significant disabilities for Landon, rendering him unable to sit, crawl, walk, or use his hands. He relies on a feeding tube for nourishment and is entirely dependent on others for his daily care and survival. Leslie is employed by Delta Borough, while her husband practices as an eye doctor at Johns Hopkins in Baltimore. They are fortunate to have excellent health insurance through her husband's employer, which serves as their primary coverage. However, the financial burden of Landon's care falls largely on Medicaid, the federal health insurance program designed for individuals with low incomes and disabilities. According to Leslie, Medicaid covers a significant portion of Landon's needs, including the supplies for his feeding tube, which cost approximately $3,000 each month, as well as the private nurse who assists him at school and cares for him while Leslie is at work. Other essential items, such as his wheelchair, are also funded through Medicaid, which is crucial for his survival. Leslie expressed her concerns, stating, "Without Medicaid, my husband and I would be unable to afford our son's care. If we lose it, we won't even be able to cover a single month of his medical expenses." The uncertainty surrounding the future is daunting. The recently enacted Big Beautiful Bill, as it has been labeled, proposes a staggering $900 billion cut to Medicare's budget, marking the most significant reduction to this insurance program since it was established in 1965. Leslie is uncertain about how these cuts will specifically impact her son's care, as details regarding the implementation of these reductions remain vague. However, she believes it is logical to assume that everyone on Medicaid will be affected. "You can't cut $900 billion from Medicaid and expect it not to impact everyone," she remarked. The proposed cuts to Medicaid would not only affect those who directly receive benefits, but would also create a ripple effect throughout the community. Rural hospitals and nursing homes that depend on these funds for their operations may be forced to close their doors. Additionally, insurance premiums could rise across the board as hospitals struggle to cover the costs of treating uninsured patients in emergency situations. This situation is just one example of the far-reaching consequences of reduced federal funding, a topic that was discussed at a League of Women Voters forum held on Wednesday evening at Southeastern Intermediate School in Fawn Grove. The absence of politicians at the forum was notable. Organizers had extended invitations to elected officials to hear firsthand from those who would be impacted by the legislation they support, yet only York County Commissioner Doug Hoke attended. U.S. Representatives Scott Perry and Lloyd Smucker, both Republicans who represent York County and voted in favor of the bill, declined the invitation, as did the state's two U.S. Senators, Democrat John Fetterman and Republican Dave McCormick. State officials, including Democratic Governor Josh Shapiro and members of the local legislative delegation, also did not attend. Carla Tolan, the moderator and secretary of the York County chapter of the League of Women Voters, expressed disappointment over their absence, emphasizing that the forum was designed to be nonpartisan and constructive. The discussions highlighted how the loss of federal funding would impact nearly every aspect of life in the county, often in unforeseen ways. For instance, Aaron Faw, director of the Stewartstown Senior Center, explained that cuts to public transportation could lead to the closure of senior centers. These centers receive government funding based on the number of individuals they serve, and if seniors cannot access transportation, many of whom rely on public transit due to their inability to drive, the centers may be forced to shut down. "We can't serve people if they can't get to us," she stated. Budget shortfalls in transit would likely result in the elimination of certain routes or increased fares, with rural routes being the first to go. This situation would not only affect senior centers, but also hinder seniors' ability to attend medical appointments and shop for groceries. If transportation costs rise, seniors will have less money available for essential needs like food and housing. The impact of these cuts extends beyond the elderly. Working families struggling to make ends meet will also feel the repercussions. "Working families are just one emergency away from financial ruin," noted Natalie Gunderson, president and CEO of the York County Community Foundation. Statistics reveal the severity of the situation. 1 in 5 residents in York County is enrolled in Medicaid, and state estimates suggest that over 9,000 individuals could lose their health care coverage due to the cuts and stricter eligibility requirements. Additionally, around 3,000 people may lose their SNAP benefits, resulting in an average loss of $187 per month for groceries. Gunderson pointed out that 1 in 4 families spends more than they can afford on housing, exceeding 30% of their income, leading to a spike in evictions, which currently stand at about 7,500 annually, leaving many families without homes. Although the foundation does not receive federal funding, Gunderson indicated that they are already feeling the pressure. "We're at a tipping point," she said. "Philanthropy cannot meet these needs. These issues are not just numbers. They represent our friends and neighbors in the community who require assistance." The cuts will affect more than just basic necessities. They will also impact parks that enhance the community's quality of life. Through a complex funding process, federal money from the U.S. Fish and Wildlife Service is funneled through the state to local governments for park development, particularly in flood-prone areas to help mitigate flooding effects. And Yost, co-owner of the landscape architecture firm YSM Associates, which is involved in park development, shared that state officials informed her that these funds are currently frozen due to a freeze on federal grants imposed by the Trump administration on January 27. Another grant program, designed to fund land and water preservation projects, including parks, is intended to be permanent and cost-free to taxpayers, with a $900 million expense covered by fees from oil companies engaged in offshore drilling. These funds are supposed to be stable, Yost explained. But at this moment, they are not. Projects are stalled. Among the affected projects is a floodplain restoration initiative along the York County Heritage Rail Trail between Hanover and Spring Grove, she noted. The loss of these grants could place a financial burden on local governments. Cuts to community development block grants, which fund essential projects like stormwater management and infrastructure improvements, are set to be eliminated entirely by 2026, shifting the financial responsibility to local governments. Last year, municipal governments in York County received $3 million in grant funding for 2024 to 2025, according to Jessica Fieldhouse, planning manager for C.S. Davidson engineering firm. Local taxpayers may also face increased burdens due to cuts in education funding. Gregory Anderson, assistant superintendent of the Southeastern School District, who oversees federal programs, mentioned that while his small district may not feel the impact significantly, larger districts like York City, Dallastown, and Red Lion could face substantial cuts to vital programs, leading to local tax hikes. He warned that previously allocated funds might not be dispersed, stating, "If those funds are taken away, the burden will fall on the local community." Cuts to the Federal Emergency Management Agency, FEMA, will also have local repercussions. Fieldhouse reported that one small borough in York County received $600,000 from FEMA to repair a damaged stream channel to alleviate flooding issues. In Dover Township, Yost noted that FEMA funds were utilized to purchase homes in flood-prone areas, assisting residents in relocating. Trump's big bill: how Medicaid cuts are threatening children's health in Texas. Imagine being a parent, desperate to get your sick child home from the hospital, but knowing every extra night brings a crushing financial burden. This is not just a heart-wrenching personal crisis, it's a looming catastrophe about to unfold across the nation. And here's the twist that's sparking outrage. Policy changes could soon make stories like this far more common. Sitting in a San Antonio hospital room, I meet a young mother, her face etched with worry, softly pleading for her child, Danny, to be well enough to go home today. "Whatever Danny needs, we'll do," she insists, carefully measuring her words in front of her preschooler. But her urgency isn't just about health. Every additional night means thousands in hospital bills because Danny has no insurance. This wasn't always the case. Danny previously qualified for the Children's Health Insurance Program, CHIP, a safety net much like Medicaid, designed for families who can't afford coverage. But enrollment is an annual hurdle. Miss a form or a deadline, and coverage evaporates. During the COVID-19 pandemic, the federal government required states to auto-renew CHIP and Medicaid to keep people safely insured. But that provision vanished in 2023, and Texas responded with a blitz of disenrollments so sweeping that the Biden administration considered intervening. According to an investigation by ProPublica and the Texas Tribune, more than 2 million Texans, mostly kids, most still eligible, lost coverage, often for simple paperwork mistakes. Can you believe this? A family's security undone by a missed form. Our hospital social workers are trying desperately to help Danny's family re-enroll, but the odds aren't encouraging. With an avalanche of applications, decisions now take months. As a doctor, my hands feel tied. Any solution risks more expenses. Danny, frightened and clinging to her mother, faces both illness and bureaucratic barriers. By morning, she is in the operating room, but the bigger crisis remains unsolved. And this isn't just a Texas story. Recent actions in Congress, most notably President Trump's One Big Beautiful budget bill, portend even deeper cuts to health spending. Last week, congressional Republicans voted to slash $930 billion from health care, as estimated by the Congressional Budget Office. Medicaid, CHIP, and Affordable Care Act coverage all stand to lose funding, with even Medicare, critical to seniors, facing rollbacks. The main savings don't come from outright banning people. Instead, they erect paperwork and procedural roadblocks. Rules now mean Medicaid recipients must work, study, or volunteer unless they're pregnant, parenting, or disabled. Here's where the debate heats up. Texas, the cautionary tale, shows that even eligible children can become uninsured if the process is difficult enough. Experts predict that between 11 and 17 million Americans could lose coverage nationwide, potentially resulting in over 50,000 preventable deaths each year. Some supporters argue these cuts would target funds to only the most vulnerable. But is a narrower umbrella really better if more people are left to face the rain? I've already seen how fragile this system is. One early casualty was a child with epilepsy. Her mother realized their Medicaid was gone only when asked at the pharmacy to pay thousands for medicine that keeps seizures at bay. Unable to pay, the child soon required emergency care. We stabilized her, but without meds, I couldn't discharge her safely, and her family, facing months of re-enrollment, had no quick solution. A charity eventually stepped in for the medications, but not before the lack led to days of unnecessary hospitalization. How many such avoidable crises will come as more kids lose coverage? Back when I was a medical student in Galveston, nearly a quarter of Texans went uninsured. Our student-run clinic became a lifeline, a place people traveled hours or simply walked in, bearing not just their bodies, but also how poverty had harmed them. Workers with poorly healed fractures, heart attack survivors unable to afford follow-up care, parents with treatable cancers, all testament to a system where medicine's promise reaches only those who can pay. I learned, heartbreakingly, to tell patients that poverty, more than illness, might end their lives. Today, as a pediatrician in San Antonio, a generous city despite its high poverty rate, I see what's possible when local, state, and federal support align. Here, property taxes bolster a county program that helps subsidize care, and most of my patients, whether on Medicaid, CHIP, or some private plan, can get the treatment they need. Even for the uninsured, we often find financial bridges, united by a shared belief. Children deserve care regardless of family income. Sometimes, the hospital itself absorbs the cost, so kids aren't turned away. Providing this level of care, after witnessing needless suffering and loss in Galveston, has been a personal relief. A small victory over a system too often stacked against the poor. Now, I can get an orthopedic surgeon for a toddler with a bone infection, support drug-dependent mothers through newborn withdrawal, or order crucial diagnostic tests, all without worrying if the family can pay. But here's the part most people miss. These resources are not guaranteed. It's only a few political strokes away from vanishing. When support falters, the cycle grows cruel. Poverty drives sickness. The price of care crushes families, and sick kids grow into adults with more health, financial, and legal struggles, often dying younger than their better-off peers. Child poverty is widespread in America, especially among kids under 5, the very age when differences in health and opportunity take root. Yet it is also addressable. The Earned Income Tax Credit, one of our best bipartisan tools, puts money back into families' pockets. During the pandemic, an enhanced child tax credit brought child poverty to record lows, and renewing it could have stabilized life for 3 million youngsters. The current budget bill does incrementally raise the tax credit and launches a baby bond savings initiative. These measures could help. But will these gains be wiped out by rising health costs? Let's not forget, the financial pain of hospitalizations often ripples outward. Parents may lose jobs as they care for sick children, miss rent, and risk eviction. I met one mother who, apologizing for leaving her hospitalized daughter alone overnight, quietly explained she had to clear out their apartment before she was locked out for missing payments. She wanted no intervention from our legal team. She simply sought to slip away with dignity. I promised we'd keep her daughter safe at night. But I knew deep down I was discharging her to greater hardship, thrust into a world where American medicine too often destabilizes the very families it should protect. When we talk about access to care, it's tempting to focus only on emergencies. But programs like Medicaid are more than tickets to the ER. They're among our most effective anti-poverty forces. They keep families out of debt, alongside crucial supports like food aid, early education, and housing. Medical bills are a leading cause of new poverty in the U.S. Even for families with private insurance, a major illness can bring lasting financial harm. When cost blocks necessary care, kids are the